This is a fantastic opportunity for us. We have the best minds in medicine, vaccine policy, and healthcare. And they're joining us here on the panel to talk about what the pandemic future looks like for India, what Omicron and the third wave is going to mean for us. And as the states are reaching different stages of unlockdown, how do we protect ourselves and our families? If you're watching us live tonight, we'd love for you to join the conversation on social media. Just use the hashtag HealthCare Awards. I am delighted to be joined by this incredible panel, and let me take a moment to introduce all of them to you. Dr. Chandra Laheria, he's a vaccines and public policy and health systems expert. He's an author, he's a TEDx speaker, and has previously worked with the WHO. Thank you so much, Dr. Laheria, for making it here and being a part of the panel.
Thank you very much. Namaskar, everyone.
Thank you so much. Dr. Nimesh Desai now, he's one of the best names in the country in the field of psychiatry. He's the ex-director of the Institute of Human Behavior and Allied Sciences. Welcome to you, sir.
Thank you. Glad to be here.
Dr. Vivek Nangia, he's an internationally renowned pulmonologist, and he's currently working with the Max Hospital. And he's someone who is in and out of COVID wards on a daily basis as a part of his job. Thank you so much for taking out the time to be here, sir.
Thank you. Truly a pleasure to be here.
Dr. Jayadeep Malothra, she's the ex-president of the Federation of the Obstetrics and Gynecological Society of India and has been working on fertility health for more than 3 decades. Thank you, Dr. Malothra, and welcome to the panel.
Thank you so much. It's a pleasure to be with all of you.
Ms. Poonam Mutreja, Executive Director of Population Foundation of India, has been working extensively on women's health and their reproductive and sexual rights for more than 40 years. Welcome to the panel, ma'am.
Honored to do that.
Grandmaster Akshar, he's an internationally acclaimed spiritual and yoga guru, has been working with people, especially during this time of the pandemic, to help build their spiritual and their emotional health. Welcome, Grandmaster Akshar.
Thank you.
Also joining us on the panel is Ishanka Vahi. She's a wellness advocate and a nutritionist who believes that eating healthy can be eating tasty. She's helped thousands of people get on the path to eat right and improve their health.
Thank you so much. Thank you for having me here.
Thank you, all of you, for being here and for being a part of the jury. And we have so many questions to go through. So let's start immediately. I'm going to start with Dr. Laheria. Dr. Laheria, my first question, the biggest concern in India and perhaps across the world, the big O, Omicron, just the sheer number of mutations and the ability to escape surveillance, escape natural immunity, and the increased transmissibility. All of this put on one side versus the apparent less severe infection. How should we view the Omicron surge? And if it is supposed to be high peaked, but a narrow wave, what can we expect next?
Thank you very much, Ms. Megha. So Omicron is the 5th variant of concern of SARS-CoV-2, the virus which has caused this pandemic for last 2 years. In the last 2 months, since the Omicron was designated as variant of concern on 26 November 2021 by World Health Organization, we have learned a lot about this virus and also the type of epidemic wave it caused. So what we know that Omicron is 3 to 4 times more transmissible, but we also know that it can cause some immune escape, which essentially means people who are natural infection or were vaccinated can still develop infection. But good part are twofold. One, it caused a lot of infection on a shorter period of time. The infection or cases rise very quickly. Within 2 to 3 weeks, it peaks and then start declining, equally sharp, steep decline. So putting all of these things together, what we can hope that Omicron is likely to affect all parts of the country in India, but the wave or peak across the country would be in the phased manner. Essentially, what we have already seen that major cities have already behind the peak, and now we are seeing urban centers reporting more number of cases, and very likely that rural India would see the wave. But going by epidemiological data and modeling studies, we can hope and some of the estimates say that a nationwide peak is already over, but we cannot rule that out because in the rural countryside, the cases are yet to be seen. Another thing to remember is that India has revised COVID-19 testing policy on 10th of January, which say that the asymptomatic in community setting and also even the asymptomatic contacts of a confirmed case need not to be tested, which essentially mean that we should not be looking at the daily new COVID-19 cases in the country. Essentially, what if the country is reporting 300,000 daily COVID-19 cases, but the testing is very different than previous, so that can mean the number of cases are really high. And we know in this wave that number of people who are like, if one individual in family is affected, other members are affected. But there are few other positive signs. One, for the study which was reported from South Africa said that people, if they are affected by Omicron variant, results develop a 14-fold higher antibodies, and then they are subsequently protected from Delta variant. To summarize, I would say that since India has witnessed a severe second wave, which had seen around 70% of population being affected, then country has vaccinated 95% of adult population receiving at least one shot and 75% both shots. And now Omicron surge is happening, which will result in improved antibodies. So we can really be optimistic that by end of March, country may be, the Omicron wave may be behind us, and we can prepare for a future which would be little better off. We might be ready for the healthy vaccinated individual, need not to be that much worried, but we need to continue to protect the vulnerable. We might have to vaccinate or give a booster shot to additional populations, but we really do not know. But what is the summary point that it is a time after end March to prepare for endemicity. It is also time that we prepare for opening schools. So it has been a challenging period behind us, but there is a light at the end of tunnel, and that light is of the future, which could be living with the COVID without much fear and staying safe.
That is really, really reassuring, Dr. Laheria, to have a stage where we reach endemicity. Let me bring in Dr. Nangia. That this fact that Omicron infections are less severe, although WHO did clarify that considering it mild may not be correct, relatively milder than Delta, but that also resulted in a lot of like a carelessness. In the public at least. So if it was less severe, did you see your COVID wards empty? Was there less pressure? Or the people who were admitted, I also want to understand, was there a commonality? Who were the people who needed admissions in the hospital or needed ventilator supports, even for Omicron infection?
Right. So that's a very valid question, Megha, and thank you for asking me that. So, WHO also said that it's all in relative terms, because we've seen the Delta wave. That is why we were finding this wave as being very mild and very non-severe. And that is the reason people were taking it very, very lightly. But the issue is that it isn't that people were not getting affected. People were not developing pneumonias. It isn't like that at all. There were people who were developing pneumonias, and these were those who fell into the vulnerable category, or the high-risk category, that is more than 60 years, those with comorbidities like diabetes, blood pressure, cardiac diseases, heart diseases, lung diseases, cancers. So they were the ones who were actually developing pneumonias and lining up in the ICUs as well, requiring oxygen support as well. But yes, when you compare it with the Delta variant, the Delta wave that we faced, the number was significantly lower. The severity of the illness also, when we compare with the Delta variant, was not very much. If I again speak that in the Delta variant, you would get a lot of patients with 20 plus score out of 25 on a CT scan. This time, I think the maximum score that we've seen is 15 or probably 16 out of 25 on a CT scan, not more than that.
Right. Yeah.
And oxygen requirement also has not been much, barring 1% or 2% of the patients where they did require oxygen support, ventilatory support. So from that point of view, I think this one was a much, much milder variant. And if it gives us a long-lasting immunity, I think then the trade-off is not bad at all.
All right. Thank you so much, Dr. Nangia, for that insight. Let me get in Dr. Malhotra now, Dr. Jayadeep Malothra. Not just about the third wave, Dr. Malhotra, but the last 2 years of the pandemic. How do you see that impact women's health do you see that impact them differently? And especially in regards to population, the pregnant women who got their rights to vaccination a little bit late. In fact, one of our nominees, you'll get to meet them, petitioned the High Court for pregnant women's right to the vaccine. Did you see them as a more vulnerable population?
Yes, of course, Megha. I think, especially the first 2 years have been really unbelievable, for women, especially women at home, women who are pregnant, not being able to reach out to the doctors, not being able to have access to good nutrition, and and the load of the disease in the house, and the mental and the physical health of the elders and the children. I think women really bore the brunt of the pandemic at the most. And as pregnant women would be concerned, I think it was unbelievable because, I run an app also called iMoms for Pregnancy, holistic care towards pregnancy. We were just loaded with all kinds of where to go. I am in pain. Doctors not accessible. There's bleeding happening, and these medicines are not available. What should I eat? What exercise I should do? So we started helping them out with an online program which has really become a hit now. And now vaccination, I mean, that was the next thing. Why should I be left? And we have to understand that pregnant women are carrying two lives, one their own and one child. So it is very, very difficult for anyone to make a decision immediately, especially when the data which we had regarding the pandemic itself, then of the vaccination, was too low and too short-lived.
Thank you, Dr. Malhotra. I'm going to come back to you for a follow-up question on that, but let me bring in Ms. Poonam Mithreja. Again, I want to stress upon the gender dynamics in COVID, Ms. Mithreja, that like Dr. Malhotra was saying, that a lot of, bearing the brunt of the pandemic and also work from home, because they worked from home for office, but also for home, and access to basic things like hygiene, menstrual hygiene products when everything was locked down, making their appointments to the doctors. How did you see, one half of this population really cope with the pandemic, especially for a country like India?
So, given the situation in India pre-pandemic, where a large percentage of women experienced violence, school dropout rates high for girls, early marriage, menstrual hygiene management, and so on. These were in many cases pandemics that we didn't recognize, and they got so exacerbated with the COVID situation that it has hit us. It's not only hit the women, but the country, if you look at the data and what happened to women. So domestic violence increased substantially. Women were locked in the houses with the perpetrators of violence, and they know where to go. Earlier, they could make an excuse, go to a mother's house, go to a friend's house, go to a neighbor's house, but now they were locked with their perpetrators. Second, you had children at home who watched, mothers being beaten, and then the burden of work. There is enough studies globally and in India this time round to show, when I say this time round, I mean in earlier pandemics, only 1% of the research focused on gender issues. So because the problem was so severe and women had to suffer so much, that the data began small studies globally and in India nationally. Several NGOs did. Women did not have access to abortion. 2 million women couldn't get abortion over that period of 1 year. The women didn't know where to go. There are women, heart-wrenching stories of women going to 8 hospitals in Delhi and not being able to deliver. And finally, the woman died. In many cases, the babies died. Women gave birth to babies on the streets as the immigrants walked home for miles together. So for women, it was the hardest, as it always is. Life is much harder for women than men.
Okay, let me come back to you, Ms. Mutreja, on that, and bring in Dr. Nimesh Desai. The mental health fallout of the pandemic, Dr. Desai, the stress on mental health, the uncertainty, fear, we lost so many people. What do you see as the impact of these last 2 years on our communities, the long-term impact of the stress that we've had on our mental health?
There's been a lot of talk about there being a psychiatric epidemic looming or a mental health epidemic.
Yeah.
What I want to say, based on a lot of data and cumulative collective experience, is that there is really no major reason for a psychiatric epidemic to be foreseen. Okay. It's not as if schizophrenia and major disorders are going to increase. For sure, what is true is psychological distress, psychological difficulties coupled with the social dimensions of well-being and a fair, just society, as my colleagues were saying. And so what we need to do is not look at the mental health needs of the society with a narrow psychiatry lens, but a broader mental health lens with well-being and social dimensions thrown in.
Thank you, Dr. Desai. Let me bring in Ishanka on that. Ishanka, with the start of the pandemic, there was this mad race towards that cup of kadha. Everybody wanted to have, the kadha to improve immunity. But
it's my go-to, kadha is my go-to also.
All right. What I want to understand from you, Ishanka, is this like an overnight? What do you think? Nutrition, eating right, is this like a quick fix? Something that will, like a magic potion that's going to completely transform your immunity, your life, your, like Dr. Desai said, also affects your mental well-being? Or is this a lifestyle change? Is this something that moving forward, as we talk about rebuilding communities and rebuilding the nation, is that something that has to be brought in as a part of, your lifestyle and your, everyday choices?
No, absolutely not. I do not think there's any magic pill that you can have and suddenly tomorrow you'll be fit and fine. It's a complete combination of your gut health, what you're eating, your fitness levels, your stress levels, how much you're even sleeping, how much sunlight you're getting. It's such a major combination that just if you get me in or one doctor in, no one can really help you. It's a complete upgrade of lifestyle. Yes, our immunity does lie in our gut health. 70% of our immunity is in our gut. So we can upgrade it. We can improve our gut health, which is where I come in, of course. But even when I come in with gut health, I try to upgrade the entire lifestyle of the person. If someone is sleeping 4 to 5 hours, how much ever I make them eat clean or whatever I do, it's not like their immunity will still be low. If they're not being well rested, if they're not practicing fitness, if they're not being active, I can give them all the good food in the world, but it won't work. It's a complete combination.
Let us also get in Grandmaster Akshar and, really talk about the strength that, spirituality, yoga at this time has given. Is it, Akshar, you've been practicing yoga for so many years. You've helped so many people. Is this feel good, or does it actually have tangible, recordable impacts to health and immunity?
So what we believe and practice, we believe in energy. We believe that everything is about energy. If we are talking here and if we are building the hope, and that's what I see our frontline warrior they did. They gave hope that whatever is happening, you be strong, and this time also will pass. New time, new energy will come. This gives, let it be, what you feel that it's a psychological, it's a reality, it's practical. But I'm getting reason to think that there is something good for me. Yeah. Otherwise, the way how Poonamji shared that what tragedy, what they are going through, women, and the way how the lifestyle changed for them, there is no hope if I don't think that good time is there. And that's what spirituality does. It brings you on that level where you start thinking good about you. If I don't have positivity in my mind, there is no way that I can proceed further now.
Okay.
Pandemic is pandemic, and that shows the limit of human. Whatever we are doing here, or whatever we'll do tomorrow, we don't know that how this virus came, what more can come. So yoga gives you that practical 1 hour, 2 hour of time where you are purely 100% engaged with your body. And we are not God. Nobody is God on this planet. Even God comes, they go. They also need to die. But that timing, that hour, 2 hour, I'm spending quality time with myself. And when you're practicing yoga, it's again, yoga is about formulas. Yoga is about science. When you involve yourself, you ask anyone who practices yoga, after 1 week, 2 weeks, they say that I'm feeling good. That means there is some movement. So we see the movement of breath, movement of blood, and how I can train my whole body for this movement. That's what the yoga science is. Spirituality brings power to human. We will not give up. Let a million times more powerful pandemic to come. Till I have my breath, I'll fight. And that's what Himalaya, they teach us. And that's what the message we shared with all our wonderful practitioners.
Yeah, that resilient spirit, that spirit of hope. I have, thank you so much, Akshar, beautifully put. I have a couple of, follow-up questions, and I'd request, brief answers. Let me start with Dr. Laheria. Dr. Laheria, there's a Boston study. Indeed, WHO has mentioned this, that as much as the virus spreads, the chances of it mutating into a more deadly kind of a variant increases. We are already seeing, like Dr. Malhotra was mentioning, the BA 1, 2, 3 sub-variant of Omicron. In light of this, I mean, we do hope that we'll see an end of no other wave after the third wave in India. But in light of the fact that Omicron is so much more transmissible, how do you see the efficacy of vaccines and a booster in light of a possible change in spike protein again?
Thank you. So the first point to remember is that Omicron or SARS-CoV-2 is a respiratory virus. It's an RNA virus. And respiratory virus, RNA viruses are known for the mutation and keep changing with the time. So that is not that much surprising. Of course, what was a little surprising that it become a little more transmissible. And there is a possibility in future also that there can be variant which have different characters, more transmissible, more immune escape. But that possibility is very limited. But good news is this, that when original virus came, everybody was susceptible. But now in the 2 years, people have developed natural infection, got vaccinated, and now Omicron infection. So people have some immunity. So even if a future variant, which has immune escape, which essentially means can pass on our immunity, it would not be like a zero benefit of the past infection or vaccination. So there might be some risk, increased risk, but the natural infection vaccination would continue to provide protection. That is a really assured part. The final point I would say that pandemic would be over, but the virus is going to stay with us. Now the level of transmission will be relatively low. What might happen that since the new variant might emerge, there is a theoretical possibility that it could be more transmissible, but that is a possibility. That is not that this would happen. And as and when, most likely scenario is that we would have a low level of transmission, but once in a while, maybe 1 year or 2 years, sometime in the future, there could be a variant which would be of concern. That time we need to again get ready and prepared for that eventuality. So scenario would be something like what happens in the people who live in the coastal area. If there is a cyclone or alert or another thing, people quickly get ready for that. Once cyclone is over, you return to the normal life. And I think that is going to be the scenario with SARS-CoV-2, that we will live a normal life for most part of the year, for many months to come. But once in a while, we might see such situation and we can respond to it. We have enough learning. So as Grandmaster Akshar said, that in the life, we should be COVID negative, but life positive. So there are a few things in which we don't want to be positive, but in the life we want to be positive. Thank you.
Absolutely. Dr. Nangia, let me bring you in. If I may ask you, it might be an unfair question, but between a vaccine/booster, testing in the light of so many asymptomatic cases versus masking and COVID appropriate behavior, what do you think is going to trump? What is going to be the most essential part of living with COVID, as it were?
So the one-line answer to your question would be a combination of all of these things put together. You know, you can't just isolate and say vaccine is like your 100% mechanism to protect yourself. It can never happen. Vaccine also has its own limitations, and especially with the newer variants coming in, we don't even know whether the existing vaccines will be effective against them or not. So to protect ourselves from all of this, I think we'll have to continue following the COVID appropriate behavior and continue masking and continue with the vaccination. Maybe a time comes where we get a new vaccine every year, you know, a modified version of the previous vaccine according to the current prevailing strain, as we do for influenza. You know, even for influenza, you get a new vaccine every year. So probably we are heading towards that kind of a scenario.
Right, right. Thank you, Dr. Nangia. Dr. Jayadeep Malothra, I have a question for you, and this is cropping from a lot of misinformation that came along with COVID, with vaccine. I mean, there was this scare that women are going to lose fertility if they take the vaccine, but also want to get an insight into what COVID did to the fertility rate in the country, in India.
See, Megha, I want to again say this, that yes, first thing is that it's that misinformation about COVID vaccine, you know, having its effects or toll on men and women both fertility. Till date, I would say it is proven to be a myth. But I would really like to tell you that the studies which we are going on, the COVID infection, we have now a number of studies which have come up which say that yes, the sperm counts, the motility and other things with the infection are definitely getting affected. We also now have some fewer studies which have come up where women who had a severe infection of COVID have had, you know, their lives turning towards having premature ovarian insufficiency or failure. Now, this is something which, as I said, because this infection has just given us only 2 years to study. These are very early studies. We really don't know. But of course, we know that, yes, there have been some effects on the fertility because of the infection and not because of the vaccination.
Bringing in Ms. Punamatreja, in a country like ours, is anyway always been a vaccine hesitancy. You know, there were news pieces of people hiding in their homes behind drums and underneath their beds because they just did not want to take, you know, vaccines. In India, it is voluntary to take a vaccine, but how do you see that impacting, you know, our fight against the pandemic?
So India is a land of myths, misconception, and misinformation, along with everything else we have. India has the biggest WhatsApp misinformation university than the world. And it is we as individuals have to blame and nobody. If we are being given misinformation, on simple things, we believe it. For instance, you know, you're talking about people having the fear that going under bed. There are villages where people ran and jumped into a river to escape the people who had come for vaccination. So given that example on the vaccination, I think my worst fears, and I'm sure the good doctors on the panel may agree with me, my worst fears was that there'll be many more people hesitating to take the vaccine and then those who've taken. Still, the number is really large, that it is not difficult to deal with this hesitancy, unlike the West, where there are those ideological anti-vaccine fundamentalists. Yeah. We don't, fortunately for India, bless our soul, we don't have too many anti-vaccine fundamentalists. We have people what I call sitting on the fence with misinformation, who are also being misguided a bit.
But let me get in Dr. Desai right now. And Dr. Desai, I also want to get in perspective of, your perspective on the population that had already been diagnosed with mental illnesses. For instance, I do want to understand what happens when somebody who's been diagnosed already with schizophrenia, for instance, how does he go for testing? How does he take vaccination? What is the sort of impact in the already diagnosed people?
That's a very good question. Thank you so much, Megha. Like it was said earlier, a lot of non-COVID care in these last 2 years kind of took a backseat. And arguably so, for all the pluses and minuses, one of which was the mental health care and the continuity of mental health services for those who were already affected and were in service. Fortunately, except for very few brief periods initially in the first lockdown, the mental health services in all sectors have kind of picked up. And yet there are those negative effects that you are referring to. People with schizophrenia, severe mental disorders, and people who are on treatment had more recurrences and relapses. The one thing that I must flag here is the extremely marginalized homeless mentally ill that I work with a lot. And that condition actually has always been and is now really pathetic. There are programs here and there in different parts of the country. So as we talk about all marginalized groups, we really need to talk about the lower end of the marginalized groups, including the homeless mentally ill. But I do think, summing that part up, I do think that I genuinely believe at all levels that by 2040, if not sooner, but 2040 or 2050, human race might sit back and look at this epidemic as a blessing in disguise. Because there's a lot of positive spin-offs that can happen, that are already happening, and that's what we need to capitalize on. That is what will show the resilience of individuals and human race.
That's a good perspective to go with when we talk to our grandchildren and say that in 2020.
Exactly. And say,
Yeah. Let me bring in Grandmaster Akshar. The states like Delhi, we've just heard that they're talking about online yoga for people who are recovering. What would your tips be for people who are recovering at home, and especially those who are uninitiated, who have not practiced yoga? What would your tips be? How do you start? What are the sort of asanas to begin with, especially when we're talking about, scratchy throat and long COVID, etc. What can we start with?
So what happened, as Dr. Desai ji shared, that in this negative time, people, they evolved also. They became more intelligent, more aware, and that's what is happening with yoga. Teachers, they are evolved now. The practitioners, they are also going deep with their inquiries. For yoga, it's about engaging themselves for their quality time, becoming more mindful, more strong. So that's what I think we need to practice, or we need to transfer with our online trainings. Asanas like Vajrasana, which they really work on our blood circulation, they work on our stomach. So spending more time in Vajrasana, that'll be, the beginning, very easy asana. Then again, very basic and simple asana like a Dandasana, where back is strong, straight, legs are out, and it's like, you're just sitting down. Sitting in that posture for longer duration, it'll again create that alertness of yours, my awareness on my breath. And what we are observing again, when I'm aware, I know what I need to do. I'm doing mistake because I don't know what to do. Like if now when you're talking about someone who need to recover, now they know what the trouble is. Those who don't know what this, the problem is, they're very casual. But once they're getting hit, they are becoming extra cautious. So what I need to consume, what I need to eat, what I need to practice, they are becoming more powerful with this thought. The asanas like Vajrasana, Dandasana, standing straight, and a basic posture, Vrikshasana. This asana also brings that alertness, awareness. And these asanas are so simple that even if I have issues of blood pressure or any other issue with my heart, I can do simple, easy asanas. So this can be part of online training, online yoga training, and breathing technique.
Ishanka, I want to get you in, because so many people recovering at home now, and I have just recovered from Omicron, and I know that extreme fatigue, scratchy throat, the symptoms of long COVID. I sometimes sit and, I'm sitting to write a script and I have complete brain fog. I know medicines can't help me. What can I have? What can I eat? What can nutrition do for me to help? And so many others who are now dealing with recovering from Omicron and long COVID symptoms.
Definitely. As actually Mr. Akshar just said, that, we cannot ignore medicine, but medicine and wellness goes hand in hand. So one thing that I obviously definitely say, and apologize in advance, that take minimal medication, only when it's really required, especially things like antibiotics and all, because it kills your gut bacteria too. Second,
get in Dr. Nangia on that later.
I'm not going to defer on his points at all. I'm talking only with respect to wellness, and they go hand in hand. When it's required, it's required. Intervention is required. But there are lots of people who I know within my circle also who just pop pills for nothing, without even consulting a doctor. That I completely do not agree with. Second, I would, as a blanket rule, definitely one thing that I would tell everyone is remove refined sugar, processed foods, junk food, alcohol, and refined oils like sunflower oil and canola oil, which basically create free radicals in our body. Remove those. Eat your whole foods. Eat your healthy, anything which you buy and there's a tongue twister, the ingredients are like a tongue twister, do not buy it. Eat your whole food, simple ghar ka khana.
Thank you so much to all the jury members for your time and this insightful conversation. Before I let you go, I would really want to get your point of view. I mean, you've seen all our nominees, you've seen the different categories. What is this sort of lasting impression that you have of these COVID warriors? Dr. Nangia, I'll start with you.
So I think this is a very novel initiative that has been taken by you and your organization to be going into these kind of aspects. People usually look at only the frontline warriors and try and award them. But this is one, you've taken a very unique kind of categorization and unique kind of awards that are being extended to all these people whose otherwise the efforts would have gone unrecognized completely. And I think there's been a very good research that has been done by our team, looking into each and everyone's individual work, their profile, and the outcomes that have been, that have yielded from their efforts. So I would like to congratulate you and your team for doing an excellent work in this field.
Thank you so much. Ms. Mutreja, I would like to hear what you think. We've been saying that win or not, every nominee for us is a hero. What do you think?
I couldn't agree with you more. Every nominee that you had there, we as a jury found, I could see difficult to I won't use nobody got rejected, but not nominating each one of them for the award was a difficult and emotional almost task for us. And your due diligence and the work that you and your colleagues have done in bringing out some of the best in our society at a time when everybody was suffering is phenomenal. And I am, in fact, each of them, I can think of connecting to them for something or the other in terms of support, more support, encouragement. I think we should reach out. If you could give the list of people, as and when I know someone who can support them, and I would like to very much keep them in my head and in my heart.
Super. Since you said that, Master Amit, our youngest COVID warrior, he needs an admission in school. He's not getting an admission.
Where is he? Where is he?
He's in Dharamshala, and he's,
If you can send me his contact, I will get that done. For sure, it will be my job to get that done.
Amazing. How amazing.
I would like to give my input. I just spoke to the educational minister, Himachal Pradesh, And I think Poonamji and me both, we can do this today only. If we need to do this, immediately we can do this.
This is fantastic. I mean, and this is the power of having people like you on panels like this, because then tangible changes can be made. Dr. Laheria, importance of data, importance of science, but importance of positive stories like these.
Thank you very much. So the list of nominees for this award reflect the diligence which Jagran team has followed for selection of nominees. We had difficulties in selecting the best out of those nominations, but it also reflects a wider work which had been done during this pandemic by the common people across different parts of the country. So I really take this opportunity to congratulate each nominee and congratulate those who are finally going to be awarded with this one. But this is really humbling and inspiring for many of us, that how each one of us can step up a bit and contribute to a bigger challenge which all of us face as a society. So really, thank you very much. And I feel really honored to be part of this process.
Thank you so much, Dr. Laheria. Dr. Malhotra, I'd like to get you in. So many women, we've seen nominees, pregnant women out on the street, manning traffic. We've seen, A&M, ASHA workers going door to door. Really the power of women during the pandemic on display. What would you say about this whole process, the nominees, and the importance of awards like this?
And not to forget the two women who have organized this. So we need to really believe in women power. And I am a firm believer in this, because without women, no house, no family, no society, no nation can move forward. So it's high time that we acknowledge the power and support them, because I always feel that if they get a small backing, they can conquer the world and bring it to your feet. And that's something which is very important. So heartiest congratulations to each one of you who have organized and who have participated and been nominated in this wonderful, wonderful initiative. Because I definitely am of the opinion, start from wherever you can, use whatever you have, do whatever you can, and don't wait for the opportunities, create them, because God has given us a very creative mind. And there are many resources which are all around us. And these nominees have actually proved a single danda was required to ask, where is your mask? Yeah. You're understanding. So, I mean, that is the impact of each individual. So we should be really having faith and confidence and trust in our own abilities and capabilities. And that is what is going to take us forward. Thank you for having me.
Thank you so much. We really appreciate you being here and the guidance that you have given us. Ishanka, over to you. What do you think of the nominees that you saw? And, what would you say to those who are standing a chance to win, some who may just lose by a whisker? But what would you say?
I think there is no one who loses here. To be nominated I would like to congratulate each one of them for being nominated. They have made massive changes in the world. And I always believe in the saying that be the change that you want to see in the world. And each one of them have proven that. And I'm very impressed with each and every nomination that we've seen today. And thank you so much for having me here to, be able to be a part of the panel. And great research on behalf of this initiative had great research. Thank you so much.
Thank you, Ishanka. And last but not at all the least, Grandmaster Akshar, what did you think of, the spirit of resilience, the spirit of, making the change, like Ishanka was saying, being the change that you want to see, mobilizing people, just, being self-starters. What do you think of the nominees that, stand to win tonight?
So if you observe, each one of them, they were serving unconditionally. They were not aware what will happen, or how things will evolve. So unconditional services, they don't need any recognition. But, to motivate and inspire the world, I think, such a divine initiative by you, your team, Jagran team, it's so powerful. And I'm very sure the millions of people, they'll get impacted. And many, they are not aware that how to help, how to support, how to do something good. So these kind of programs or these kind of initiative, they lit that fire. They are the seed which will give ideas to millions to become one society. What we believe Vasudhaiva Kutumbakam will become one family, and we can, with these kind of divine actions, we can evolve as human and achieve that life of health, peace, and happiness. So my good wishes for all these warriors. We are not choosing who is the best. It's because of the format that someone is doing special, but I think each one of them, they're unbelievable. They are beautiful spirits. My prayers for each one of them and for your entire team.
Yes, yes. And Grandmaster, actually, you're absolutely right. In fact, there were so many warriors that we reached out to and we said, give us pictures because, we want to be able to show it in an AV. None of them were working for documentation. None of them were working for photo ops. None of them were working for awards. But, I think platforms like this kind of reaffirm our faith in humanity, in our community. And this, we hope, tonight, everybody who's watching, who heard this, discussion with all of you, will leave a little bit transformed. We'll do our bit. We will wear that mask. We will practice social distancing so that the work that all of these warriors are doing does not go in vain. Thank you so very much for speaking to us on this panel, for giving us your wisdom, your time, and guiding us into choosing the winners without any fear, without any prejudice, without any pressure.